any good dentist and medical doctor should be somewhat holistic. And all that means is that they're not only looking at the mechanical, in the case of dentistry, success of the restorative work, let's say a filling or a crown or a bridge, but also how does that procedure, how does that material impact the overall health of that patient's body, their biochemistry, their physiology, their emotional state, their energetic state, and so forth. So when you do a procedure or you implant a device, whether it be a filling or a crown or anything like that, into the body, it may be helpful to know what that body tolerates and what it doesn't. None of the dental materials that we use are something that the body has ever seen before. They're all foreign bodies. Some of them are flat out toxic, like mercury is toxic. Certain forms of nickel are flat out toxic. Lead is toxic to everybody. But some materials that are not toxic can cause an allergic reaction or a delayed allergic reaction. And these reactions can be found on certain types of blood tests. We were one of the first dentists on the east half of the country, I think, to use the Clifford materials test. It's a blood test that can screen patients' immune systems for reactivity to about 18,000 different dental restorative materials. So we can look at, does a patient react to a filling material or a crown or a denture, braces, implants? So that's one thing, is that seeing how the body reacts if it does have a problem with things, and then using materials that are benign to that patient. And everybody's chemistry and physiology is different. So everybody is different, but there are some materials we found that almost no one does well with, and some materials that 96 to 98% of the population do just fine with. So in our practice, we've been doing this test for about 35 years. And we found that certain materials we can safely use in almost everybody, but not everybody. And so we give that as an option to patients if they want to have this test done. If they're concerned, if they have autoimmune problems, they have a lot of allergic problems, they react to, let's say they have pierced earrings and they get allergic to the earrings, and that's a sign that certain dental materials would be problematic for them. So it may be something that they would consider. So that's one thing that we do. I think holistic dentistry is the same as conventional dentistry, but we just maybe look at a few other factors with how they may react to things like this. And again, I think a large part of it is going back to what I learned from Dr. Gelb, is that, we listen to patients. Learning from the patients is how we grow as clinicians. And so we do want to know their emotional state, their physical and spiritual well-being. Not that we're treating those things directly, but we want to respect what they're coming in with and do procedures that are going to support, not undermine, those parts of their wellness. And we focus on fostering the body's innate ability to heal itself, and we try to provide treatment options to patients that can enhance their overall health.